वेलकम बैक स्टूडेंट्स। तो आज का हमारा टॉपिक है जेरियाट्रिक्स, दैट इज़ हेल्थ केयर ऑफ एल्डरली, फ्रॉम BSc न्यूट्रिशन सेकेंड ईयर 4th यूनिट. सो लेट्स स्टार्ट. ओल्ड एज. ओल्ड एज इज़ बेस्ट डिफाइंड एज द एज ऑफ रिटायरमेंट दैट इज़ 60 ईयर्स एंड अबव. जो भी लोगों की 60 ईयर्स से ज़्यादा एज है उनको ओल्ड एज में गिना जाता है, लाइक जेरियाट्रिक्स कहा जाता है उनकी स्टडीज़ को. इम्प्रूवमेंट इन हेल्थ केयर टेक्नोलॉजी हैज़ रिजल्टेड इन इंक्रीज लाइफ एक्सपेक्टेंसी. हमारे साइंस ने बहुत सारे ऐसे टेक्नोलॉजीज डेवलप कर दिए हैं जिसकी वजह से हेल्प हो जाती है लाइफ, यानी कि 60 ईयर से ज़्यादा या फिर ज़्यादा जीने के लिए हेल्प होती है. सक्सेसफुल एजिंग इज़ डिफाइंड नॉट बाय लॉन्गिटिविटी अलोन बट ऑल्सो बाय सफिशिएंट वेलबींग in multiple domains, socially, physically and mentally. The three components for successful aging are avoiding diseases, engagement with life and maintaining high physical and cognitive function. What is meant by process of aging? Process of aging is a normal process, begins at conception and ends only with death. Individuals are known to age at different rates. Heredity and good nutrition may slow the aging process so that the individual enjoys physical and mental vigor in his 80s. Goal of nutritional care should be help to the aged achieve a healthy, purposeful and independent living. The process of aging brings about physiological, psychological and immunological changes which influences the nutritional status. The changes associated with aging. As part of aging process, the functioning of the organ may change, which may influence nutrient status. Changes in organ function with aging that may influence nutrient. For number one organ or function, then changes, then effect on nutrition. First is taste and smell. So what changes happen to the taste and smell while aging? Decreased taste buds and papillae on tongue. Effects on nutrition: less ability to detect salt and sweet, and decrease in taste and olfactory nerve endings causes decreased probability cause poor food intake. Number 2 are salivary glands. Changes: decrease in salivary secretion causes feel of dry mouth and xerostomia, that is mouth becomes dry. Then nutritional effect: decreased sensory stimulates may impair release of enzymes. Difficulty in chewing and swallowing make them avoid certain foods, particularly crunchy, dry and sticky. Number 3, teeth. Loss of teeth and wearing dentures. Decreased consumption of fresh fruits and vegetables. This can result in decreased intake of energy, iron and vitamin, particularly vitamin C, folate and beta carotene. Number 4, gastric function and emptying. Decreased secretion of HCl, intrinsic factor and pepsin. Decreased bioavailability of minerals, vitamins. Above 60 years of age, rapid rate of emptying of liquids. Decreased absorption of protein-bound vitamin B12 and folate. Increased proximal small bowel pH and bacterial overgrowth in bowel. Increase in bacterial folate synthesis to counteract malabsorption. Number 5 is small intestine. What changes occur in small intestine? Decreased secretion of lactose can be a risk factor for developing osteoporosis. Number 6 is liver and biliary function. What changes occurs in liver and biliary function? So decreased size and blood flow, minor structural and biochemical changes. It causes rate of albumin synthesis may be decreased. Gallbladder becomes sluggish in releasing bile. Gallbladder which it releases bile, so it becomes sluggish, means it releases slow bile juice. Bile juices help for digestion. It causes susceptible to gallstones. Activity of dry metabolizing enzyme reduced. Drug dosages may need to be lower. Number 7 is metabolic function. Impaired glucose tolerance requires dietary modifications. Decreased metabolic rate due to changes in body composition and reduction in physical activity. Exercise, oral and pharmacological agents. Requirement of energy decreases, activity decreases, body protein level decreases. 8 is neurologic function. It happens confusional status. Decreased synthesis of serotonin, carnitine derived from amino acids, lysine and methionine may be effective in slowing mental deterioration in Alzheimer's disease. Immunocompetence, that is, immunity declines with age. Carotenoids seem to play a protective role related to aging and cognitive function. Supplementation with vitamin E, zinc, and unsaturated fatty acids can be increased. Number 10 is psychological factors. Depression, it causes depression, can affect appetite, digestion, energy level, weight, and well being. Number 11th is cardiovascular function. Blood vessels become less elastic and total peripheral resistance increases. Prevalence of hypertension, to diet accordingly. Nutritional requirements. These are based on the physiological changes that take place during old age. The nutritional requirements change after the age of 30 years. After the age of 35, the BMR decreases due to reduced muscle mass and other disease. Aging causes reduction in physical activity, which affects the energy needs. Resting metabolic rate decreases approx 15 to 20% over the lifespan, primarily due to changes in body composition and reduction in physical activity. Sarcopenia, an old age related loss in skeletal muscles, is the result of a decline in muscle strength. The average body fat in percentage in males increases from about 15% when young to 23% at the age of 60 years. This change in body fat is attributed to less intense physical activity and to an alteration in less intense physical activity and to an alteration in testosterone and growth hormone. Production is affected, anabolism and also tissue growth. Protein for elderly. A protein intake of 1 gram per kg, the normal adult requirement, is safe during old age, since caloric requirements are decreased without the corresponding decrease in protein. The food should be protein rich compared to normal adult diet. To meet his adequate qualities of protein, foods such as milk and curd can be included. Deficiency of protein results in edema, anemia, and lowered resistance to injection. Of the total caloric intake, 11 to 12% should be form of protein. Carbohydrates for adults. An impaired glucose tolerance in the elderly can lead to hypoglycemia, hyperglycemia, and type 2 diabetes mellitus. Insulin sensitivity can be enhanced by balanced energy intake, weight management, and regular physical activity. Whole grain cereals and pulses should be included in the diet. It is necessary that at least 50% of calories are derived from carbohydrates. Carbohydrates are the chief source of energy. Since caloric requirements are reduced when carbohydrates intake is also reduced. Next is lipids. Emphasis should be placed on reducing the intake of saturated fat and choosing monosaturated or polyunsaturated fat sources. Minerals. Calcium needs during old age increases. Women over 50 years of age who are not receiving estrogens require more calcium. There is increased losses resulting in demineralization of bone and cause osteoporosis. For women over 50, 1000 mg per day is recommended. Calcium absorption efficiency diseases, vitamin D levels decline, and hence men also require more calcium. Milk is an important source of calcium for elderly as it is the diet for the young. The caloric requirement decreases, total food consumption decreases, hence calcium supplements are essential. Iron deficiency in an elderly is caused by less iron intake, blood loss due to chronic disease and or reduced non-heme iron absorption secondary to achlorhydria of atrophic gastritis. Iron absorption does not appear to decline significantly with age. Vitamin C deficiency may also impair iron absorption. Mild anemia affects the health of old people due to less efficient circulation of blood. Iron intake should be adequate to prevent anemia. Consumption of lime once or twice a week is effective in combating such a tendency. Particular emphasis may be placed upon the inclusion of those green leafy vegetables which are good sources of iron like mayalu, also known as Malabar spinach, cauliflower greens and agati, and whole grain or enriched breads, and to certain iron rich dry fruits and use of iron fortified salt. There is no evidence that moderate sodium restriction will delay or prevent the onset of cardiovascular diseases. Some features of old age, such as delayed wound healing, decreased taste sensitivity, and anorexia, are also findings associated with zinc deficiency. Vitamins. Elderly people are at risk for vitamin D deficiency due to decreased exposure to sunlight or decrease in renal loss. Prudent dietary supplementation with calcium and vitamin D improve bone density and may prevent fractures in a healthy elderly population. Requirements for the vitamin and mineral in many elderly persons aging to atrophic geriatric which interferes with absorption. Severe deficiency of folic acid in the elderly may result in anemias and elevated serum homocysteine levels, a risk factor for cardiac disease. Water. Water can be consumed as such as or in the form of buttermilk, fruit juices, porridge, or soups. Some elderly individuals may have a fading sense of thirst and may go for long periods without fluids. Others avoid liquid for fear of continuous dehydration can result in mental confusion, headaches, and insolubility. Elderly should be advised to have liquids at regular intervals even if they are not thirsty. Fiber. Fiber stimulates peristalsis. It also helps in reducing cholesterol, which may reduce the incidence of atherosclerosis. Atherosclerosis is a condition of hardening or accumulation of plaque in the blood vessels and arteries. Excess of fiber may reduce the absorption of iron and certain trace elements. Certain whole pulses may produce flatulence in the elderly, hence, such pulses should be avoided in the diet. Sulfur containing vegetables are avoided if they produce gas and discomfort for the elderly. In general, principles for planning a nutritious diet for the elderly are similar to those for younger adults. The most important guidelines is to provide meals and snacks that are nutrient dense, visually appealing, tasteful, and of the appropriate consistency. 4 to 5 smaller meals are often more acceptable than 3 substantial meals.